morning, Joanna. Very nice to meet you. Yes, please have a seat. I'm gonna explain you what is the diagnosis that has been made by the doctors you have been meeting. So, they diagnose an osteoarthritis of your hips, so in both sides. I don't know if you got the chance to get better explanation about it. Not really. So, osteoarthritis is a disease that's affecting your bones, and actually the cartilage that is making the junction between the bone is disappearing, which causing the pain that you're feeling at the moment. And I guess that's one of the reasons why you're meeting me today. So we're gonna try to deal with that. It's degenerative, so it means that we're gonna try to work on slowing the process and making sure that this osteoarthritis is not worsening with time. So we're gonna work together with that. What I wanted to say as well is that it is very important for you to remain active. I know that you have a past of sports history, very impressive, and I know that you are still very active, and I wish that you would continue to do that. I know that sometimes you feel pain when you are going for a walk, and that walking as well is part of your job activity, and I understand it's linked to your salary somehow. So we're gonna work on that, but to make sure that you remain active and that it doesn't affect your work and your incomes finally. So did you have any questions for me? You want to know when you will be able to walk again properly. So like I was saying, we're gonna work together so that the osteoarthritis doesn't progress, or to slower the progress. I know that you have been complaining about limping on the right side especially, yes. And what we're gonna do is to work on muscle and the flexibility, the strength and the endurance. So to reduce that, first to reduce the pain, but then to reduce the limitations that you can have in terms of strength and in terms of mobility, so that you can walk again properly. I don't want you to walk with a stick. Maybe it could help for temporary, but I'm sure that we can work that way together, that it won't be necessary. You're still young, you're 59, and that's also one reason why we're choosing conservative treatment, because this endoprothesis, so the surgery replacing her hip, is effective for 10 to 15 years, and I don't see yet the point, at least, for you to go to surgery. And we have different solutions here that I can offer you, and we're gonna do this together. You want to continue this Nordic walk, I think it is very good, and I'm sure that we can find some solutions to control the pain level that will allow you to continue that. It is very important for you, and also I understood that you go to walk with a friend, so it's very good and important. And conservative treatment, so what we're gonna do together has been proved to be efficient. There is many studies about it, and we have some tools again to work on the pain. So I could talk to you about the medication, because I know you're not taking any medication to control the pain. We can also do some TENS if you're aware of it, yes. And ultrasound, as well as acupuncture, that could temporarily at least lower your pain level and allow you to participate in your daily activities, so including the work and your hobbies, to go walk with your friend and also take care of your grandkids. I know it's very important for you. Then I will combine manual therapy and exercise therapy. So we can do some, for example, traction. I don't know if you're aware of that. So here I can show you on a model that you have a hip, left side and right side, and here is the femur that comes in here in a ball and socket joint. And what's also causing the pain for you is that this cartilage that makes the movement smoother is disappearing, as well as the bone getting a bit closer to each other. So with traction, this movement, we will try to improve the range of movement, and it should also lower the pain and allow you to have a better quality of life. And yeah, finally, what I wanted to say is that I'm optimistic, and we're gonna work together, and I'm sure we can achieve great results. I would like to make a better assessment today of you. And what do you think if we would agree to assess again in 6 weeks to see the progress and how far and what you have achieved? And what would also the idea is to allow you to go back to your work activity, and also together we could go through self-efficacy techniques and techniques for you to manage during the day with pain and with movement. So I hope we can do this together, and that's pretty much it.